All right, so I'm Valerie Early of Nutrition Connection Balance. I'm the owner and I am a registered dietitian. I also have some other things in my background. I specialize in nutrition and hormones and preventative medicine. I'm a certified medical exercise specialist. I'm a Reiki master since 2003. I've done 2 natural bodybuilding shows, first place in the masters category. And I have run 3 marathons and many 2 and 5Ks, and 6Ks and 10Ks and that type of thing. I am a mom of 2 biological children and 3 wonderful stepchildren. And I don't even call my stepchildren anymore, they're my children. And I'm an entrepreneur. I always have felt like we need to empower women in many different areas of our life. And so that's always been my life passion. As far as a registered dietitian, I just want to make sure you know the difference. There's some concerns today over different certifications and degrees. And I want to make sure that you do know that everybody has a wonderful opportunity to educate, no matter schooling, no schooling, what have you. But a registered dietitian has to have 5 years as a school, have to have a medical internship, we have to take a test, and we have to have 75 hours every 5 years of continuing education. In the state of Illinois, I'm also a licensed dietitian nutritionist, and every state has a different certification. Registered dietitian takes precedence over every nutrition degree, though. And then an advanced medical exercise specialist, so that you know that's why I am qualified to talk about bones and density. And then I also keep up my pharmacy technician license. I ran a compounding pharmacy for many years, from 2002 to 2005. And my job there was to bring products based on research and also bring in different things that affect women and men's hormones. I have seen over 18,000 patients since I've lived in Illinois since 2002 practicing. And I'm an author, and I have multiple videos and lectures. Also, my videos are on our website, and so you can get those too. And I've owned my own practice since 2005. So that's enough about me. We want to talk about you tonight and your bones. We had a really great event last night live at Pure Juice in Arlington Heights, one of my favorite places, just because of Paulina, the owner, and the staff are just fabulous with their beautiful food and beautiful tower garden and green drinks and salads, and just they promote everything and offer everything I believe in. And it's really nice to go when you don't feel like cooking or doing something and have somewhere like that to go to get a really good clean wheatgrass or a good juice or a good smoothie. So we're going to talk tonight about bones, though. We're going to talk about testing, vitamin D, hormone balance, minerals, strength training, and high impact exercises, phytonutrients with plants and pH, how to control inflammation through omegas, and then prescription medications and how those affect bones, and also extra over-the-counter help for osteopenia and osteoporosis and bone preservation. So why do bones matter? And if you read my email that I sent out today, I put this exact information in because I think sometimes we just think it's normal, and it's not. So first of all, by 2020, which is next year, we'll have over 14 million people that are 50 years and older that have osteoporosis. 47 million over 50 have osteopenia, a lone bone mass or softening of the bones. And they're predicting by 2040, it's going to be double to triple those cases. And those are statistics by the International Osteoporosis Foundation. And that is not normal, especially when we look around the world. So I'm going to help you understand why and how to prevent to be in those statistics. And you can only imagine how many I have that are in the thousands in my practice that have osteopenia, and they're in their 20s and 30s. 1 in 5 people die within a year after a hip fracture. 95% of all hip fractures are caused by a fall, and hip fractures cause earlier death. So there's reasons that we want to make sure that our bones stay healthier. And it's a personal matter for me. My mom, this is my mom's only selfie with me some years ago, maybe 3-4 years ago, but my mom had 2 hip replacements at a very young age. And so the first time I did my bone density, I was around 28 years old and I had osteopenia. So whether it's genetic or because of other reasons, it was very dear to my heart. And my mom was in lots of pain because she was so young. Health insurance would not cover her bone replacement and hip replacements until they were bone on bone. So obviously I have a very personal interest in this, and I really do care about patients because it's painful and it really causes debilitation, as you heard earlier, deaths and other problems. So we don't want this to be you, your mom, your grandma, your sister, or anybody, your dad that you love. Uh-oh, let's see. Okay, so the first thing is you want to get the right assessment. It's a DEXA scan. They actually call it a DEXA now. It's a dual energy X-ray absorptiometry. It actually uses 2 X-ray beams, and it actually tells you your bone density. It's really easy to read, but I'm amazed when people have their bone density, they still have no clue what it means. So basically, when you look at a bone density, you want to look at T-scores, and that you have the beginning of bone softening or osteopenia when the T-scores are -1 to -2.5, and you have full osteoporosis when it's -2.51 or greater. And so one of the 3 different things here that's important is that we're starting to see the last 4 or 5 years, it's really unfortunate, but when often people get a bone density, they're looking at one femur and the spine. Well, you have 2 legs, and the femurs, the small part of the leg that goes into the hip bone, are very small and can fracture easily. And then obviously you need a total hip or right and left because you have 2 sides. So you really want to try hard to be able to, if you're higher risk, over 50 or high family risk, to make sure you get total hip or left and right hip, left and right femur, and the spine, L1 through L4. So make sure you get the right tests. The other thing is that a lot of people ask me, they know I'm very integrative, I don't like a lot of tests because of the side effects and risk, but technically when we look at a DEXA scan, often it's actually less radiation than a dental x-ray. And if you've ever been to the dentist, even when you have x-rays, what do? They put a huge metal, a whole jacket over you and run out of the room. So, I'm not a big fan, but you can't feel bones. So you really have to have the test to know if you're at higher risk, and so on. You can detect bone cancer also, and a lot of times when people have cancer, it can metastasize or grow to the bone. So an x-ray, I've had 2 cases where we found out they had bone cancer and had no knowledge of that before. If you have a high risk, like I have done mine every 1 to 2 years, and most of the time every year since age 28. And after about 3 to 4 years, I was able to completely reverse my osteopenia. I'm 52, and I'll be 53 this year, and I have all positive T-scores still since my last bone density last year. So it is important. The earlier you catch it, the easier it is. And then you want to test every 1 to 2 years, or if you have extra risks. Part of the issue is that the doctor has to code it. And if you have a high family risk, that's one code. Once you have a T-score that's a -1.0, you have a permanent diagnosis. And the other thing is that Medicare often will only pay every 2 years. That's what they tell you and the doctor tells you. But if they code it because there's a fracture or a high risk, then you can get it covered. And that is something that most insurance will cover. The doctor just has to diagnose it and code it correctly. So make sure you fight for what you need if you think you're at risk or if you're over 50. So let's talk about vitamin D. So we know that you want to get a DEXA scan because you can't feel bones. You want to know what your T-scores are. And vitamin D is the one I'm going to spend the most time on because it's the one that has the biggest impact on your bones. And the good news is it's fairly easy and fairly inexpensive, but it's specific. So number 1 is you do not want the prescription vitamin D. The prescription vitamin D is 50,000 IUs. Every time someone finds a vitamin D, that's what the doctor puts them on, and typically it's the wrong form of vitamin D. So 1, the wrong form increases thyroid problems and other hormone problems. And 2, any woman or man that's ever dealt with any hormone issue or fluctuation like a menstrual cycle or a pregnancy, we do not, or even diabetes, right? That affects insulin. We don't want our hormones to be up and down. It is not good. So you don't want a 50,000 for 2 weeks and then don't take D or a low dose. You want your vitamin D to be steady because vitamin D affects everything. It is a hormone. It affects the insulin sensitivity. It affects your energy production in the mitochondrial cells. It affects IGF, insulin growth factor, that affects us with aging. And I can go on and on and on. Basically, what you want to know is that vitamin D is extremely important for bone density. It is number 1. There are other benefits from vitamin D, so that's the good news. One is that they showed a 50% reduction in colon cancer when you're on 2,000 IUs of vitamin D. When you have higher circulating levels of vitamin D from birth to age 20, you have a much lower risk of MS and all autoimmune diseases. The number 1 factor for bone health, I'm going to repeat it over and over, is vitamin D3. Adequate D levels also stimulate and help make serotonin. Serotonin is the main neurotransmitter that affects depression, sleep, metabolism, so pretty important. And after taking D3 for 2 years, someone that had cancer then had a 25% reduction in death. And again, this was by Harvard Medical School and epidemiologists. They also show another risk in also developing some kinds of other forms of cancer, but we don't have time to go into everything. Just want to let you know the good news is vitamin D has mainly health effects, and other risk factors are also affected by it. This one I put up because this is something that's happening that we're finding new. That is, people get older, and I like to call them our elders because it's more respectful, it's more wise instead of just saying someone's older or younger. Is that one of the things that's about half of all elders have happened is they have body and muscle pain. They actually find one of the biggest causes is a deficiency in vitamin D. So just because you're older does not mean you have to have pain. Also, they found if you have lower levels of vitamin D, it impairs your kidney functioning, and also that's very important. So there's all these different things that happen with aging that makes us not metabolize vitamin D as well. So they also found very conservatively that there's a 15% reduction in hip fractures and 30% reduced hip fracture, period, when someone has enough vitamin D in their system. So very interesting, again, of how important this is, and yet we know so little, and I would bet 70% of people that even come into my office that are more, well-versed in things are still not in the right form or the right amount of D. So let's talk about that. First of all, 66.8 million people aged 1 and greater have medically deficient levels of vitamin D. Medically deficient, 21 to 29. 23 million aged 1 and above have less than 12 of a level of vitamin D. You never ever, by even the most conservative specialists, want your vitamin D ever to fall below 30, and never again. Whether you have a 1-year-old, an 8-month-old, or a 40-year-old, or a 90-year-old. Second is really the minimal, based on most of the studies, is you want your vitamin D levels, 25-hydroxy-D3, to be always 50 or above. Males ideal based on seeing patients, looking at clinical pathways, looking at other hormones, looking how it affects other markers from cancer to hormonal changes. Men are 65 to 100 if they're age 12 and above, and any females, especially 12 and above, I aim for 75 to 100. And there are medically significant things that start to happen within 1 to 2 years. So it's very, very important. So what form of vitamin D? Well, first of all you have to remember is the magic number 1 to 2,000. If you do not do a blood test, then you want to get 1 to 2,000 IUs of vitamin D. There's a dropper here. 1 drop is 2,000. A bottle lasts you 3 to 4 months. You put 1 drop on the back of your hand, lick it off, put it in a shake or put it on a spoon. If you do have high taste sensory, then it kind of tastes like paper. If you don't, if you're an average taster, I'm a super taster, then you'll taste nothing. Or there's a vitamin D capsule and you want to take 1 or 2. I have 1,000 in my office. I also have a 5,000. I prefer you do not take more than 1,000 to 2,000 without a blood test. The average person that I see needs between 1,000 and 20,000 a day to get their levels normalized. If there's other medical things going on like high insulin or other hormonal type of pathway issues, then sometimes we have to use a combination of capsules and drops to get that level to respond. One of the things that I like to do is always, I'm very integrative and I go a lot by what I see from multiple studies and with my thousands of patients clinically. But I'd like to always mention very clinically oriented studies like I did with Harvard Epidemiology or American Medical Association. This one is where they looked at numerous medical studies, and every study done on vitamin D only shows if someone takes 800 IUs or more, remember that 1 to 2,000, they all had health and bone benefits. So again, please make sure you get the right form, the right kind, and if you can, anytime you go in, you go for a blood screen, you go to your gynecologist, you can go to walk-in labs or ARC labs, you can get it ordered yourself, and then I can tell you how much you should take individually. And then you'd retest in 2 to 3 months until you get it to 65 to 100 if you're a male, 75 to 100 if you're a female. If you don't want to listen to that, no matter what, 50 to 100. You can always call our office and get the capsules or the drops. You do not have to be our patient. I did in the email that I put out today, put a product list with prices because I got bombarded yesterday, 2 days ago when I heard some people and some patients knew and colleagues that I was going to be doing the bone lecture. So my husband put a nice sheet together that I did incorporate in the email that I sent out so that you have a bone factor sheet of the information I'm going over today, and then also the products and how much they cost, how many's in there, so you know what to order for your family. If you have someone very young, under 12 or under 80 pounds, then I do have a drop that's 400 IUs, and you can just start them on one. Whenever I had my kids, as soon as I had my children, from the time they were born, I put a 400 drop in their mouth. And my boys were bigger, so by the time they were 8, I was already measuring always their blood levels and then giving them between 2 and 4,000 is what they needed. So again, if you have someone that's very small, you can order the drops in a 400. I also have a chewable. So 1, we learned how to test. 2, we learned why it's important. 3, we learned vitamin D is the #1 factor. Another factor is hormone balance. And if any of you know me, then you know that's my specialty, and I can talk all day long about hormones. This is going to be a 2-minute part of the discussion. Basically, you need to know that all the hormones affect your bone density, especially estriol. Most people don't know there's 3 estrogens, and they can negatively or positively affect your bone density. But estriol is the biggest one that's more age-related. It affects bone density, vaginal tissues, and urinary incontinence. And so estriol falls off as we get older or after we're through menopause. And it is 80% of the 3 estrogens and can directly affect your bone density. So a lot of times I have people just make sure we test their estriol if they don't want to do a whole saliva test. And then if they're low, they can use a topical that I have in my office that I don't have to give a prescription. And they can just put a little bit on their wrist or a little bit on their labia. So very simple. You also want to manage cortisol. Cortisol is also best and even medically diagnosed by saliva. And if someone's very sick and we think they have an adrenal disease, which is very rare, I've only had 2 cases and thousands of patients ever, then they also have to be hospitalized and you test by saliva and urine. Testosterone directly affects bones, and the good news is if you're a woman, if you have low DHEA and you take DHEA, it directly affects testosterone. So that can affect your bone density. All of these hormones specifically directly affect bone density. So it is important to know the saliva test, and if you do have osteopenia or osteoporosis, I hope you will for sure test your estriol. All right, we've got a question. Let me look here and see if I can figure it out. Oh, I gotta get my glasses. Okay, so how do you feel about hormone replacement and increased risk ovarian cancer? So the thing is that that's because of the forms. First of all, people use synthetic hormones and they don't measure. I don't have any concern about using a bioidentical if we measure by saliva, and the amounts that I have to use are so small, you would be shocked. Most people that get bioidentical or synthetic hormones are completely overdosed. So also estriol is used for centuries without it complicating other types of cancers, causing or contributing to it if someone's already had cancer. So that's a good question. So blood versus hair. So blood works on, we're talking about minerals next. And I'm going to take questions at the end, just so you know, because it distracts me and I'm not real good technology. So I'll take the questions at the end. I'll look at that chat after. Thank you, though. I will take questions. First, we want to look at blood versus hair analysis, and that's because we want to look at minerals. Blood transports outside the cells, and it's the outside tissues. It's a later indicator of problems. So by time things show up, let's say low serum calcium or high serum calcium in the blood, you're already very sick. It's way later. Hair actually shows inside the cells, affects energy production, is a much earlier predictor, and is more preventative. So I am a firm believer, and I'm not even going to go into this, but a firm believer in hair analysis for all minerals and toxicities. And in my opinion, you should have it done by the time you're 4 years old, and you should have it done every 10 years, no matter what. And if anything, always 50 and older. So you have a baseline, so that if cadmium, if aluminum, things start to accumulate because we're older and we can't get rid of it, it increases our risk of different cognitive and other autoimmune diseases. So you can have something to compare it to as you get older. But in relationship to bones, hair tissue minerals directly These three can directly affect bone density: calcium, boron, and strontium. This particular patient's a great example that the calcium's perfect. The boron, which is very far forth from the left, from the right in the purple, is 0. And then their strontium is also too high. So right away, if I saw this and I saw they have a toxic level of 3 items that are higher than they should be and 1 toxic level, that my very first concern, I don't care, and I won't tell you how old this patient was, but they were in their 40s. I won't tell you who the patient is, but they were in their 40s. And my very big concern was they already had osteopenia or osteoporosis. Sure enough, they had a bone density, and unfortunately, they did have almost full osteoporosis. So it was not a calcium deficiency. It was that they couldn't lay down bone and they had other toxicities and things were out of balance. So once we got that going, things are a lot better. So hair tissue analysis is very important because calcium, boron, and strontium directly affect bones. And so when people go and they get a calcium, magnesium, boron, strontium, bone factor minerals, it does not work. In fact, it's dangerous in my opinion. And the reason is, and I'll show you in the next slide, is because if you look at this particular patient, then you can see they do not need more strontium and calcium. It will actually hurt them. And they'll have more bone loss, or they will have other things with the carotid arteries that I'm going to show you. And around that, this is the biggest myth. Number 1, vitamin D is the biggest factor to help your bone density. The biggest myth is calcium is the answer. That is wrong. Only about 10% of any of my patients, especially women, ever need to take calcium. If they do, there's certain forms, certain kinds, certain milligrams based on their hair tissue and their vitamin D level. Here's an example, and we can go around the world for so many countries and look at this. And I just want to give you one extreme so you understand. African Bantus women have approximately 350 milligrams of calcium or less per day, and that is through their mainly plant foods. They birth an average, can you imagine, of 9 children. They breastfeed for 2 years or more. And as someone in my live clinic said yesterday, oh my goodness, that's 18 years of breastfeeding. Isn't that incredible? Talk about incredible women. I don't know how they do it. But they rarely, if ever, break a bone, and they rarely lose teeth. So calcium does not affect bone density. It is a myth. And so when I ask people, when you have a bone density test, what do they write? Go home and take 800 to 2,000 milligrams of calcium. That is wrong information. And you already heard our statistics of 66 million people having osteoporosis. So it is not working. The reason that I'm anti-calcium, unless I do a hair tissue test and absolutely know if someone needs it, not based on osteopenia or osteoporosis, is because if you take unneeded calcium, it will stay out more in the tissues, and then you have a 22% increased risk of calcified arteries. This is a key sign of heart disease. Eating foods with calcium, especially vegetables and certain powders with leafy greens, reduce the risk of heart disease by 27%. So these are some of the statistics by the Journal of American Heart Association. And I can tell you many of these. For years, I said, do not take calcium unless you have a hair test. And if you do take calcium, it better be the right form. Because if you take the wrong form, which is carbonate, and a few others, it also contributes to hardening of the arteries and valve problems with the heart. I only mentioned this slide shortly because I almost never give vitamin K with my patients that need calcium or vitamin D. And the reason is, it's not that K is not important, is that I teach my patients to have a salad or vegetables a few times a week or every day. And regardless if they do that or not, I would say 90% of my patients are on Juice Plus. Juice Plus has enough vitamin K, E, C, and all the other nutrients, so you don't have to take separate. And vitamin K is a feisty type of vitamin. It can cause some pretty serious bruising, blood thinning, and a lot of times people don't tell you the truth about medications, how often they use Advil, ibuprofen, and non-steroidal and anti-inflammatories. So you want to be very careful when you take K. If I do vitamin K, and I do have vitamin K with D in my office, it is strictly for someone almost always that's elderly and will not take the Juice Plus or will not, in addition, eat any green vegetables. So we'd much rather you do it through diet and through the Juice Plus capsules because you get so many all benefits and less problems. But I do want to mention it because that is significant. They do work together. So the next one, oh, let me see. Let's see here. Oh boy, hold on. Okay, we got to go back. All right, so here we are. Phew. So we're going to talk about strength training next. So remember, we talked about a DEXA scan and the reason you want one. We talked about vitamin D, right? Then we talked about minerals, okay? And now we're talking about strength training. So strength training, if you want to have good bones, it's strength training. Pretty much, if you go to any doctor and, you know, whatever age, they'll just tell you to walk. That is not true. First, I want to say, any exercise is better than none. I don't care if you're stretching on your floor, if you're walking up and down the steps, always any exercise is better than none. But strength training, especially resistance training, squats, leg press, free weights, 3 times a week, 20 to 60 minutes is a must. And I just tell people I don't want to hear excuses. Any age I work with, we can teach you. We can teach you how to do sit-ups from just your chair without using your arms to start if we've got someone older. So there's all different ways that you can learn resistance training. You want to keep reps to 6 to 8, and you want to do 3 to 4 sets. One of the best exercise physiologists in the world has a book called Astrofit, Dr. William Evans. And, you know, he was brought in as an exercise physiologist because when you work with astronauts, they lose an incredible amount of bone when they go up into space. So I said, if they can lift weights in space, I'm sorry, and do impact exercises, you can do them at home. So you don't have to be a gym rat like I am or love the gym. You can get a few pair of hand weights. You can have gallon jugs. People have luggage. They have so many books, so many different things today that you can do a resistance training. The good news is that's what favors the most, that activates osteoblasts. Those are the things that boron and those things help with favoring bone deposition to help your bones form better, thicker, stronger. Remember, bones are like tissue. They're not like a log. So they regenerate. They can turn over. So when someone has osteopenia or constant fractures, even at an earlier age, they'll tell them you can't fix that. That is absolutely not true. It's just not true. You have to work hard, as you hear, because there's many different factors, but it absolutely can change. One new study that I had just in the next slide, which I'm just going to briefly show, but was a brand new study that actually showed if you can't and won't do higher intensity, heavy resistance training exercises, then you could do high intensity, higher rep training. They've always said that doesn't work as well. You know, you can be lean and again, it's good for you, but this was a very specific study, and the good news is it's pretty intense, 70%. Most people exercise at their one repetition. They usually exercise like when they're exercising. If we say on a 1 to 10, what's your perceived exertion? They would say, oh, I'm about a 5. 70 to 80%, hard to breathe. Can't really talk to your friend a lot. You'd be talking on the treadmill or running, you know, you gasping. So, and then something like a stress test when you're running all out and getting your heart as high as it can is more like 90 to 100%. So 70% is pretty intense, but they had to do it 75 minutes 3 times a week. Doesn't it make more sense to do 6 to 8 reps, get some weights at home, and do 20 minutes 3 times a week? Just saying. The other thing is that what I put a disclaimer in here first, that I don't know you. You know, I have an advanced medical exercise specialty. I'm putting this in here because I want you to know I always get, well, can I just walk? Can I just swim? Can I bike? You can do anything you want. All exercise is healthy for you. But if we're talking about bones, it needs to be resistance training. They do show high impact things like running and jump rope, box jumping, those kind of things can help also with bone density. But they're very hard on the joints as we get older. And of course, you don't want to lose your balance or have an injury and not be able to exercise at all. So that's a disclaimer that those are things that a lot of times if I have a younger person or someone healthy, I'll say do resistance training for 20 minutes instead of going out for how do you do exercise twice a day, then do jump rope 2 minutes in between, that type of thing. So you can incorporate some high impact if you're able to with resistance training instead of doing 2 workouts a day or knowing what else to do. One new study that was really encouraging in 2018 in the Journal of Bodywork and Movement Therapies was a Pilates reformer twice a week greatly reduced the risk of falling and helped with bone density, and even once a week had an impact. Someone asked me last night, we're not talking about Pilates with just movements, we're talking about a machine that you lay in. I did a really wonderful presentation to a Pilates reformer class in the Cleveland Clinic in Ohio a few months ago, and they had a whole room full of awesome Pilates reformers. So again, it's very specific, but it's encouraging that at least it's a little bit more. The other thing I do want to mention is as we get older, or any age over 25, you lose a ½ pound of muscle every year. So if you don't do resistance training and you don't exercise, you're going to not be as healthy. It doesn't mean you're going to be normal weight. Weight does not equal health either. I have lots of skinny fat people, and so we don't want muscle wasting and bone loss. Okay, so please exercise and start with anything versus nothing. All right. The next one was just the resistance, and that was the first study that actually showed lower weights and higher resistance repetitions could help bone. So it was our first one. So that was encouraging, at least. So it wasn't so, hard to just say you had to strength train. The next one is pH fruits and vegetables. So they show if you have a male vegetarian, they only have a 3%. They have a 3% risk of developing osteoporosis. Male meat eaters are 7%, female are 18%, and female meat eaters are 35%. The highest category of osteoporosis are in meat eaters. Now, one of the things I want to say about this study, and the reason I put it in here, is to encourage you to eat more plant foods. Plant foods and the pH are interrelated to bones. Most of the cultures that have really good bone density, and there's many cultures around the world that almost, again, have no cases of teeth loss or bone density issues. They are by the sea. They have high level of vitamin D levels. They're usually walking or having weighted things to carry, from water to different things to groceries every day, and they eat mainly plant foods. Plant foods, especially green vegetables, are the only alkaline producing pH foods there are. I have a lot of people that love to argue this, and I just tell people that when you base things on biochemistry, if you test the blood, it has to be a certain pH or you'll be in the hospital or be dead. When we talk about pH in the urine and the saliva, the only absolutes that are pH and alkaline forming are green vegetables. Someone will say, no, on this one chart it says a pear is, on this one chart an apple is, on another says apple cider vinegar is. It's not true, because as soon as you swallow it and your enzymes and acid affects things, it changes it. So you can look at one university and one food's on an acid list, one's on an alkaline list. We want more alkaline forming foods because it affects the pH and affects our bone density in a positive way. So the whole thing with this study that I believe, because of working with so many patients, I'm not anti-protein. Everybody's different. Everyone has a different body type and need different things. But the point here is often meat eaters are the ones that are eating hamburgers, French fries. They're not eating any grains. They are not taking Juice Plus. So again, I don't believe it's just because they eat meat. Because also when I have low protein eaters, they have lower bone density. It's that they're eating meat and no green vegetables, okay? So hopefully that helps. But it's inspiring, right? Because you want to be able to have other reasons. Tower garden, I just put my new lights in my tower garden. I don't even have the plants yet. So the plants are seeding and growing. Hopefully they'll be in next week and big enough to put in. But I have my new lights and oh my God, it's so pretty. The tower gardens are aeroponic. You can grow 20 plants or more 3 to 4 times faster just with water and nutrients. It tastes great. Children love the tower garden. So do men. Men and children like to see things, feel it, touch it, cut it. So I highly recommend getting a tower garden. I have one right in my waiting room in my office. We have one on our patio. So, it's really important because you can grow plants faster. For the average family with 2 to 6 people, it pays off in 6 months what you buy in greens and salads. So please think about getting a tower garden for whoever invited you today. You want more of the green drinks. You want more of things like Juice Plus. Juice Plus and Vineyard Blend are a foundation. They do affect bones. And the reason is that, again, when you get fruits and vegetables, especially the powders, you're not having carbohydrates, you're not having contaminants, herbicides, different things because of the NSF label. You are keeping your system more alkaline. So it's extremely important to take 2 red, 2 green, 2 purple a day. For 25 years or more, I have said Juice Plus and Vineyard Blend, vitamin D, and omegas. Those are the foundation no matter what first. Then if you can afford it, you go to all the other things, okay? Those are the things that greatly affect every single organ system in your body and has the best body insurance that we could give you. And remember, so far we're on vitamin D, 1,000 to 2,000 IUs by capsule or drop from my office, red, green, and purple capsules of Juice Plus from whoever invited you. And then again, making sure we get to the omegas, which we haven't gotten to yet. All right, get that screen. It's been fussy today. Sorry about that. So Juice Plus is unique. As I mentioned, it has over 35 peer-reviewed medical studies. It's dairy-free, gluten-free, People can do it because it's a capsule, it's not juice. I love the complete shake because the complete shake has extremely good nutrient profile. It's 6 different plant proteins. It's got some powdered calcium in it that I've never seen change a hormone in a negative way and never seen someone's hair analysis go the wrong way. And it's 8 grams of fiber. We're always looking for things that are fast food, I call it. You want things that are proven. You want things that won't hurt your health. We want things that don't jack up the blood sugar at any age because it causes mood issues, and we have enough problems with eating and everything else and overtasking. And you want fast food. I tell people nothing is faster than putting a scoop of the complete in a shaker, adding water, and you're done. You have multiple different plant proteins. You've got 8 grams of fiber. You have something that does not blow up your blood sugar, whether you're healthy, in type 1 or type 2 diabetic or insulin resistant. For heaven's sakes, do it, okay? I always talk about the price because people ask. I said the best part is the price. And we even talk about the red, green, and purple Juice Plus, or if we add the omegas in, we're only talking about $2.38 a day and up to about $4 a day. If you have the shake, then we're adding around $5.50 for one meal. What do people spend on one Starbucks? Again, we have to look at the value of things, and you get one body, and your bones are certainly part of that structure. So after pH, exercise, vitamin D, and minerals, we're going to inflammation. Inflammation turns on all disease. Inflammation contributes to bone loss because it's live tissue. 90% of Americans do not get enough omegas based on statistics. So you want to individually assess and treat it. You want to test your blood for cardiac CRP or highly sensitive C-reactive protein. And then you want to test a little finger stick test that you prick your finger and then you fill this little circle of blood. We have a omega clinic at our office. I think it's $189. You get the whole 8-page report. Then you get a webinar that helps you understand what omegas you should go on for your body. So it's essential, and it has hundreds of other studies for everything else in your body. Remember, omegas are part of that foundation you need. And then also remember cortisol also. Remember, it degrades bones, it causes more acid. When we're looking at the omega test, you want your index to be 10 to 12%. And then the most important thing in relationship to bones, though, is this page 2 of the report. This is not my report, but I showed it to you because of someone that had full osteoporosis. And this is before I even knew her minerals or had anything else. She was just in a clinic. I guessed that she had osteopenia or osteoporosis because we knew she didn't have cancer and some other things. And she didn't have rheumatoid arthritis. And her acid level, that AA is arachidonic acid, was 29.6 to 1. It's supposed to be 8 to 1 or less. So my concern was, did she already have bone loss or something breaking down her tissues? And her 6 to 3 ratio was also in the red zone. That means she had so many 6s from breads, from too many plant oils, that type of thing, not the right omegas, omega-3s, that she was increasing her inflammation that was causing joint pain and bone loss. So very important test. So you want to take and eat the right individual essential fatty acids for you. If you will not test and you don't know what in the world to take, you take 1,000 to 2,000 IUs of vitamin D. You can either call my office and get the Pro EPA Extra if you're over 50. If you're not over 50, you just call and get the Pro Omega. And if you absolutely don't want to test, you don't have any idea what you need, or you're vegan or vegetarian, then you want to take at least 4 of the Juice Plus Omega blends. No matter what, 2's better than nothing, but when I do the test, nobody ever has an ideal level on just 2. And again, when you do more vegan and plant-based, you have to have a little bit more, okay? All right, so you've learned a lot about what you want to do. Now, what about other options that you're told about by advertisements, by your doctor, by your endocrinologist, by your MDs, and that type of thing? Mainly TV and Sally Fields, though. And that is, here's your prescription medications: Fosamax, Actonal, Reclass, Boniva. What is very deceiving is that the first 1 to 2 years, when you take those medications, it actually will show improvements in your bone density. But then what doctors do is they purposely don't test it again. And by time you do test it again, after 2 years, you almost always have worsening bone density, and you have femur cracks, your bones fall apart, your teeth crack and fall apart, and then you have severe reflux, blood clots, heart attacks, and strokes are higher risk. Certain medication, prescription medications, directly cause bone loss at any age. All the reflex medications, steroids of any kind, seizure medications, breast cancer treatments, thyroid medications, and blood pressure medications. Now again, just think about our population. If you went in the room and there were 100 people, I bet 90 out of the 100 would be on one of the medications on the right if they're 25 and above or had one of those conditions. And it may be younger than that now, you know, because I see it all the time. So you want to be aware of things that cause that. Again, when we look at other countries that don't have bone loss, they don't do these things. They do not take prescription medications like we do, and they certainly do not take bone prescription medications because they increase the problems after 1 to 2 years. Here's one example, a brand new one that just incredible to me. I didn't change a thing. All I did was take a screenshot. So look at this. So I tell people, pay attention. You know, if you look, this new one, I don't know how to even pronounce it, time loss. Isn't that funny? Time loss. Look at the bottom right of the screen. It says very clearly, you don't even have to look at the side effects. It'll take you an hour to read them. Right there, what is it? And then what's the most important information I should know about it? The most serious side effect that it can cause, it didn't say maybe, is bone cancer. Can you imagine? So here you have osteopenia or osteoporosis, or worried about it. You take a medication that causes bone cancer. I just don't understand. So you've got to be an advocate for yourself. You've got to ask questions, and you really want to look at the other options that you have. Now, if someone has osteopenia or osteoporosis, I left this in as a funny thing, only because sometimes technology is so discouraging. I tried everything in every way to turn this around. I couldn't get it. And then when I finally got it even to turn sideways, it was backward. So don't ask me how I did it. You know, I'm magical, let's just say. But collagen, there are other things that can help bone density. There are 3 other things, very specific forms, amounts, kind, how much you take, that if you've gotten your vitamin D, you have your omegas, you're on the Juice Plus, you're eating greens, you're eating less meat, you are strength training, and your minerals are good, and you still need more support, or you're not slowing down your bone loss, then you may need 1 or all 3 of these things. These all have advantages. I show you the first 2 on the right, the collagen building formula, because as we get older, it's one of my top 10 for someone that's over 50, because there's other benefits for the skin, the nails, the hair, the joints, the health, the immune system, besides the bones. I already do a smoothie. For my entire life, I've done a smoothie, 1 to 3 smoothies with a complete and or whey protein since I was 15 years old. So to me, adding a scoop of powder that has that kind of benefits, it's in my top 10. I started adding it when I was 50. Regenemax, if you have any hair loss problems, higher hair loss, thinning of hair, nail breakage, really has some good research for helping with bone density and with hair, more skewed towards the hair and nail area. So Regenemax, or someone that doesn't want to do a powder, it's 2 capsules a day. Neither of those do I have to ask you anything if you get those forms, those amounts from my office. I do want to say with a disclaimer that a year and a half ago, I made my scientific project for 6 months was the collagen. And I was mortified because the top 2 collagen products on the market had one of the forms of collagen double than it should be. And 100% of my patients that I knew were taking it because it affected their minerals in a negative way, and then they had started to have kidney dysfunction. So I am very, very, very picky about it. So I only have 1 form of collagen building formula in my office. It's a powder that I'm sure about, that I take, and then the Regenemax. Neither of those do I have to ask you any risks or side effects or anything about you, whether you're 20, whether you're 80, or whether you're on 1 medication or none. So those are very safe. Ostera I throw in there because I'm a very practical person. Let's say you're on this webinar and you have a mom that's 88. She smokes, she's on 10 medications, she doesn't want to do anything else, but she's had a fracture or 2. Then you want to do 2 things no matter what. I mean, you can sneak them in. For goodness sake, get her on vitamin D, get her a capsule, stick it with her other medications, you know, or get her blood test done so we know how much. Put a drop in her food and get the Ostera. The Ostera, for anybody that has T-scores of -2 or greater, or have fractures, or will not do all these other lifestyle things, you can either add it on additionally. You know, when I have someone with a high -2.5 or 3, you bet we do every single thing we talked about. And I've had every patient's maintained or gotten better. But Ostera with vitamin D, if you've got someone that's resistant, won't do a lot, really could help. I mean, it's really, at least we can give them something, and it's still better. I wish they'd do the lifestyle changes. I wish they'd take the Juice Plus. I wish they would strength train, because you have all these other benefits. But still, if you love the person and they're having fractures or high risk, for heaven's sakes, get them on D and the Ostera, okay? So we have, at our clinic, we have a hair tissue testing. So when we talked about the minerals, and then we have an omega testing. We have one on March 9th, that if you call like tomorrow, you could still possibly get your results back in time. If you don't, you'll have to go on the May one. And then I have one on May 1st. So those are ways that you can get the test done, and then I do a webinar. I'm going to be adding one on September 18th, but I'm trying to work on it where I have a recorded webinar, and that way I don't have a date. So anyone could call in, do a clinic, and then just get a recorded webinar. It's just going to be easier. It's just so hard. People do the webinars and then they constantly cancel and want to do another one. It's just too confusing. So I'm going to be working on that for the September one, and hopefully even sooner, so that I won't do it live anymore. I'll have a recording. And so that way someone can watch it over and over, and they don't have to have an appointment. But that allows them to get all the information. That allows them to get all the information and products. That allows them to get their test result and make it really, really affordable without having to be a patient. Okay. Then we have at our staff, we have a great website, nutritionconnectionbalance.com. My web person, I spent some time with her today. We're going to see if we can get these webinar recordings on our website. And so I hope that you will share events, share our webinars, share the links, and really help people stay healthy and fracture free. So let me look at what the other question was. I'll answer that, and then I will end the recording. All right, let's see here if I can figure it out. Get my glasses on. Okay, I answered that question, so I think that's it. So I'm going to pause and